Hello, everyone, and welcome. My name is Jasmine Alderson. I'm the spa director here at LUX Medical Spa. Thank you so much for joining us today. Today, we are going to learn all about products and treatments for uneven skin tone with our licensed esthetician, Susan Ciccarelli. We have just one little poll that we want to launch to you guys real fast, just to get an idea of who's watching, what they are here for, and that way Susan will be able to target her presentation based on what you guys want to know the most about. So I'll give everyone about 30 seconds or so to answer. I think it's 2 or 3 questions. Answer the poll, and oh great, some questions are coming, or answers are coming in. Give everyone just a couple, about 30 more seconds or so. As you're doing that, just to go over a little bit of housekeeping, if you have any questions during this presentation, please message me. My name, again, is Jasmine Alderson, and I will interrupt Susan as she goes and make sure your questions get answered. We have about 50% of the votes are in, so about 10 more seconds, and I'm going to end the poll. All right. We have, the first question was, are you concerned with dark spots and sunspots hyperpigmentation? 83% said yes, which makes sense why you are here. If so, have you done anything to use this, to help treat this? 17% of people said they've done nothing. 17% says they've used over-the-counter skincare products. 17% said they've used department store products. This is great, 50% of people say they have used medical-grade skincare products. 33% have used chemical peels, facials, etc. 17% said lasers, and 17% said all of the above. That's great. And then the third question was, what are you here to learn more about today? 92% want to know, Susan, about their at-home skincare products. And then 75% want to know about in-office procedures. So it's great. Well, just to tell you a little bit about what we're doing today, of course, we're learning about products and treatments for uneven skin tone with Susan. Susan Ciccarelli is one of our licensed estheticians. She was a graduate of the University of South Carolina with a bachelor's degree in liberal arts and an associate's degree in science. She is one of our founding LUX ladies. She's been with us for about 6 years. She's done some advanced training in Abaji Aesthetics Leadership Community member. She's done training with Patrick Bitter, Jason Posner. If you've been to any of our presentations before, you've probably heard they are the masters of the Cyton laser. She has been to the laser safety course with John Hoopman. That's something we actually make all of our employees go to, whether they actually use the laser or not. She's been to Cool Sculpting University in 2017, and she's certified provider of Cyton laser, microneedling, advanced chemical peels, microblading, hydrofacial, and Cool Sculpting. So again, if you have any questions along the way, please feel free to message me, and I'll get those questions to Susan. But without holding her up any longer, take it away, Susan.
I just lost my screen. I don't know when.
Oh no, I can hear you.
It just completely went away. Okay, sorry. It is not sharing it with you though. I'm not. Sorry.
That's okay. Will somebody message me if they can't see my screen?
Okay, it's back. I don't know what happened. It just cut off. Hi, everyone. So bear with me because I'm terrible at stuff like this. This is my first time doing a webinar, so it's very different format versus seeing a patient in person and doing a consult. So topics that we will discuss today are types of pigment, basically discussing the different types of pigment that cause discoloration and uneven skin tone. We will discuss medical grade skincare, specific products sold at LUX that are designed to treat pigmentation in the skin. We will also be discussing some treatments, in-office treatments to enhance and maintain your skincare results. A little note about any photos that you see, if they are LUX patients, all of our LUX patients have given us written consent to use their pictures, and we love our patients, so we thank them for that. And don't worry, if you come to LUX, we will not use your photo unless you have been asked to, or if you offer that. So types of pigment. Hyperpigmentation is a common condition in which areas of the skin become darker in color than the normal surrounding skin. The darkening occurs when an excess of melanin is produced and forms deposits in the skin. Melanin is basically the pigment that gives our human skin, hair, and eyes their color. So I've listed a few different types of pigmentation. The first is age spots. In the center of that photo to the far left, you'll see a large dark spot, which is a seborrheic keratosis. That is a little different than a normal age spot. It usually will have some texture to it. They can become very dark, and they just come with age, and it's a genetic thing. Some people will get them, some people don't. Most are completely nothing to worry about and benign, but always important to not be the deciding factor of that, but instead to go in and have a skin check yearly with your dermatologist. The second photo is freckles. Almost everybody has a little bit of freckles, and they're basically just clusters of pigment that develop. Again, most are harmless, but they can be treated if there's something that you don't like on your skin. The third picture to the far right is melasma. And so melasma is a common pigmentation disorder that causes brown or gray and sometimes almost green looking pigment on the skin. And it can basically form in patches, and hormones are a big trigger for melasma. It's more common for women to get melasma than it is for men. And it can come with any change in hormones. And it's not just pregnancy, it could just be with age. So another type of pigment to the left is post-inflammatory pigmentation. Post-inflammatory is usually a temporary type of pigmentation that's followed by an injury or an irritation to the skin. An example of post-inflammatory pigmentation would be acne or dermatitis, eczema, or even just getting an insect bite on the skin that you've scratched, and then you notice that you have some pigment changes after that. And the last picture is a picture of redness, and this patient obviously has some rosacea, and you can see the little vascular lesions, the little facial veins that are below the skin. And this can also happen with just age, genetics, and just sensitive reactive skin. So before going into any of the wonderful products that we have, the most important crucial step in your skincare routine should always be sunscreen. It's very essential to protecting your skin, and it accounts for 80% of our aging. The photo to the top right, it just speaks volumes. I don't know if anyone's ever seen this photo before, but it is of a trucker who did not use any sunscreen, and obviously the left side of his face was exposed to the sun. He's lucky in the sense that he doesn't have a lot of brown spots on the skin, but you can see what that sun exposure has done to his skin in the aging process versus the right side that wasn't exposed to the sun as frequently. We carry several different brands of sunscreen. I've listed just a couple on the screen, Elta MD, and then Color Science, which is a favorite of mine because it's easy. You can brush it on, wonderful for a woman who has makeup on or doesn't want to just be messing with a liquid sunscreen throughout the day. You can get it on the hairline, around your ears, in every little crevice of the skin where you may not be able to apply sunscreen without taking a little bit more time. And you always want a broad spectrum sunscreen, and ideally a physical sunscreen would be the best, because that's going to be the best protection from UVA and UVB damage. And for the, I'm getting a little pop-up here, so I'm learning. For the month of May, sunscreens at LUX are buy one, get one 50% off, because it is Skin Cancer Awareness Month. I had to think about that. All right, so that's a good thing. All right, so going into medical grade skincare versus over-the-counter skincare. A very simple definition between the two is the FDA divides skincare products into two distinct categories, cosmetic and pharmaceutical. Cosmetic is over-the-counter skincare that is defined as ingredients applied to the human body for cleansing and beautifying purposes. Pharmaceutical, medical grade skincare, which we sell here at LUX, is defined as affecting the structure and the function of the skin. So really having the ability with medical grade skincare to change the composition of the skin. And so counterfeit skincare, especially during this time with COVID and everything that's going on, I'm seeing a lot of companies trying to promote their skincare and sales online. And I always recommend to patients to go in and see a provider, see a physician, esthetician when purchasing skincare, because going online, you're just not sure where you're going to get it from. So just be aware that if you do not purchase medical grade skincare through a physician or authorized reseller, the quality and authenticity of the product may be diluted, expired, or counterfeit. It may not be safe to use or perform as expected. And I took this list off of Obasi's website, and I think it's a great example of how misleading it can be buying skincare online. If you look to the list on the right side, you can see that there are companies out there using Obasi with their website to promote. And companies, ZO, SkinMedica, Obasi, they spend a lot of money and a lot of time prosecuting and suing counterfeit retailers. And that is just a very short list. All right, so the first thing that I wanted to talk about in going into hyperpigmentation and some of the pictures that we saw of the different types of pigmentation in the skin is Obasi NuDerm. NuDerm is a kit that Obasi developed 30 years ago. It is still the #1 medical grade skincare dispensed through a physician. And it can treat a myriad of different things. Some of the ones I listed were age spots, rough skin, erythema, redness in the skin, a yellow complexion, or hyperpigmentation, basically discoloration. It's more ideal for brown pigmentation, but if you have post-inflammatory pigmentation, which will appear red or purple in color from acne, it is wonderful for that as well. What is unique about the NuDerm system is the hydroquinone. And so if you're familiar with hydroquinone, it's basically an agent that will lighten the skin, an active that will lighten the skin. Obasi has a patent formula on their hydroquinone that nobody else has. And the two products in the kit that use hydroquinone are the clear and the blender. And the reason why there is two is one is working on the pigment that we see, and then one is working on the pigment that is deeper. So you really get great corrective, but you also get good preventative for that pigment that's going to surface. This kit is pulling that out very quickly. So it's a complete transformation of the skin and the pigment. And going into hydroquinone really quickly, basically hydroquinone is blocking the melanocytes that produce melanin. And so it's basically shutting it off. So these are patients that I treated myself, and the reason I chose these is the type of pigmentation they had and the type of patient they were. And for this woman, she did not want any downtime. She was busy with traveling, and she was also acting in a movie role at the time. And so she first came to me and said, I need to change my skin. She just felt that it was dull, that it was pigmented, it was dry, and she was just not happy with the amount of makeup that she was putting on. So no downtime, and then between her pigment. So if you look at her pigment, you can see that she has kind of a golden undertone to her skin naturally, but there's not a lot of variation between where her spots are and then her natural skin tone. So with a patient like that, this is a very safe product to use because it's only going to work where there's damaged melanocytes, where there's melanin that is damaged and that needs to be corrected. It's going to give the skin a very even result. And so you can see these pictures were taken a little over 2 months from her start date with the kit. So pretty amazing to see. Not only did it transform the pigment in the skin, but also the skin looks smoother, brighter, more hydrated. So it really is a complete improvement for the skin.
A couple people said, love, so good. We had somebody ask, did she just use products or did she have treatment as well?
No treatments during this time. This was products alone. No lasers, no peels, no injections. I saw her for her initial consultation, and then this was, I want to say 8 or 9 weeks after she began the kit, and she had only been using NuDerm.
Thank you.
So the second patient came into me with a very different concern. She had progressive acne. Her skin was very congested, as you can see, and she was actively breaking out, but her skin tone, she's a darker skin tone. And so really with this, we were trying to clear the acne and then clear what looks to be scarring, which is post-inflammatory pigmentation from the acne and from picking at it and just the inflammation in the skin. So these pictures were taken 4 months after she began the kit. No other treatments during the time, just solely using this kit. Again, she didn't have the opportunity to have downtime because she was in the military, but also with her skin tone being darker, this was a very safe and effective treatment for her skin.
They want to know, are there different kits for different skin types?
There are 2 different kits. So there's one for a normal to dry skin type, and then there is a kit for normal to oily. The difference between the 2 is the type of exfoliation in the exfoliating product and then the type of cleanser, but everything else is the same.
Thank you.
You're welcome. And so this last patient, this is actually a photo from Obagi, and just seeing the difference in skin tones between the last patient and this patient, it is effective and it is safe for every skin tone. This is a patient that had melasma, and so you can see that mask of pigment. And so the overall improvement of the skin, not only for the melasma, but just any sunspots that she had. And so we're going to show you a little video of a patient that was treated with NuDerm.
Hi, I'm Megan. I'm 36 years old, and I wanted to share with you guys a little bit about my skin journey. About 5 years ago, after the birth of my first child, I noticed that my skin had taken a huge transformation. It was so uncomfortable. I wasn't happy in my own skin. I had hyperpigmentation, melasma across my forehead, above my upper lip, and shortly after that, I was introduced to the NuDerm kit. NuDerm kit has totally changed my life. I feel at this point about 4 months consistently. After that, I lost the pigmentation, the melasma, and since then I have been able to maintain my skin in the situation that it's at now with a vitamin C serum, a hyaluronic acid, a retin-A, as well as heavy use of sunscreen. I can't thank the NuDerm kit enough, and I would recommend it to anyone. Thanks for listening, and I wish you guys the best with your skin journey.
So with that patient, when she was talking about using NuDerm and then transitioning after that, it is important that after you get the result from something like using NuDerm or using hydroquinone, that you pick up where you left off and continue with medical grade skin care. So I wanted to talk a little bit about some other options we have in addition to NuDerm. So our Lumen skincare line is very unique because it's personal to us, and it can be custom compounded with hydroquinone and retinoic acid. So for a patient that is not a NuDerm candidate or doesn't need that kit, or for a patient that needs everything to be simplified and doesn't need numerous steps morning and night, we have 3 options that can be compounded with the hydroquinone to work on pigmentation in the skin. The first is the Luminous to the far left. That is hands down my holy grail. It is my go-to. I've used it for 3 years, and just like everybody else, I will get bored and think that I need to change to something else, and I always end up going back to Luminous. What is unique with Luminous is it almost has the ability to be an Obagi kit in one. It is fortified with kojic acid, lactic acid. There is a very gentle vitamin C that's very tolerable for patients. But in addition to the actives that are built in, we can then go and add in hydroquinone or tretinoin, which is a retinoic acid that is right for that patient's type of oil production and for their skin. So it is a quote unquote night cream, but it is very much an all-in-one. If a patient wants to simplify even more and they just need hydroquinone or they just need retinoic acid, we can start them with the middle with the custom complex. And again, it has the ability to put in the percentage of retinoic acid that is right for that patient, and the ability to put in hydroquinone. And that has an emollient base to it, so it's very moisturizing for the skin as well. So it's great when someone's making that transition into medical grade skincare. And then the last product is our vitamin C brightening serum, and that also has the ability to put in hydroquinone. So in addition to the vitamin C and the protection with the skin with that, then you can also have the hydroquinone to work on pigment. And then going in a different route a little bit, talking about pigment and redness in the skin. And that we want to address a little bit differently if there's not, brown pigment on the skin or it's not post-inflammatory pigmentation, and a patient has just all over redness, they do have rosacea or they have dry, dehydrated skin, or just sensitive, reactive skin, then we have plenty of products with our Lumen skincare that can address that. The first that I have listed is the Lumen HA Advanced Gel, which again, if I could take a bath in this stuff, I would. And I know my patients hear me say that all the time, but I mean it. Hyaluronic acid is very important for the skin. It works like sodium in the skin, and it basically hangs on to the water that is in the skin, helping it function better. And so if you think about your body, and if your body becomes dehydrated, you're going to become lethargic. You're not going to have that same strength that you usually have. And the same thing happens with the skin when it gets dehydrated. The barrier is impaired. It's going to react and become sensitive to things. And it's just that whole aging process is going to speed up because the body's metabolism is slowing down. So it's very important to maintain the hydration in the skin. And so the Lumen B3 is something that you can layer on top of the HA or use by itself for a patient that needs that barrier repair directly on the top layer of the skin. The HA will kind of sink into the skin and you really won't feel it because of it being a serum, but the hydrating B3 cream, it has the anti-red, it has that B3, but you'll feel a nice hydrating layer on the surface of the skin. And then something to complement those is our Lumen Daily Brightening Pads. And these are great because think of it like the step of a toner on the skin. So you would cleanse your skin, give it a few minutes to relax, and then you can go ahead and use a brightening pad. They say daily because they are gentle enough to be used daily. However, I have plenty of patients that do not use them daily, that may use them every other day or a few, 2-3 times a week. What is unique about these pads and how they really help redness and sensitivity in the skin is they are formulated with azelaic acid, which is an antimicrobial and anti-inflammatory. It has antimicrobial and anti-inflammatory properties, which can help with post-inflammatory pigmentation from acne, rosacea, all those things that we were discussing. And then going into, this is where treatment meets skincare. So we have peel pads, and these are to be used about once a week. I occasionally will have a patient that will use them more than that, but really they're designed for a weekly peel, so an at-home treatment on the skin. The first is the brightening peel pad. So picking up where we left off with the daily brightening, this brightening peel pad is mirrored the same, has the same type of acids that the daily brightening pads have. However, this is stronger acids, higher percentage of the azelaic acid. And then the glow pad. The glow pad has TCA, which is trichloric acid, and it has salicylic. We call it a glow pad because it gives a wonderful glow to the skin, because it's really removing that dead, dull skin that's sitting on the surface. And so you get that, refreshment to the skin. And it is great too for texture of the skin because of the TCA acid. So this is a pretty universal pad. Everybody can benefit from it. It's just a really good exfoliation for the skin. And then on the far right, the Lumen sensitive peel pads. They are also formulated with azelaic acid, and they are formulated with mandelic acid as well, which is a gentle exfoliation for the skin. So my patients that come in that are very weary of exfoliation or have sensitive skin, these are wonderful. The response has been great with these. I use them on my skin. I try to use them about once a week. Very easy to just cleanse the skin with any of these pads. Swipe the pad all over the skin. You can leave on the skin for about 10 minutes. You can work your way up to where you're leaving on the skin for 30 minutes. I do have some patients that just sleep in the peel and do not cleanse it off the skin. But it is a very easy process at home to get a good exfoliation from the skin. Get the skin active so that it's functioning better and strengthening.
We did have a question. They want to know, can any of these skincare products be used for nursing or pregnant mothers?
So the daily brightening pads, actually no, because they have salicylic. They are basically in the category C, which is considered to be used with caution. None of these pads have vitamin A or retinoic acid, which is definitely not something you want to use, but salicylic being a derivative of aspirin, it's something I tell my patients, that they were, recommended not to use. So I would say no to that, but I'd have to check on the sensitive peel pad if that definitely has salicylic in it. I know it has azelaic and it has mandelic, but even though it says gentle exfoliation, I believe it still does have salicylic.
Someone else said, they asked a question and then you answered it immediately. So she said, good job.
Thank you. I'll just talk forever. All right, so briefly, I'm just going to go over treatments for correcting pigment as far as laser goes. And we've had a few webinars now on laser, which are all on our YouTube channel, which are great. So if you want to go more in depth to laser, you can check those out. But these two pictures are great to me because when you're using medical grade skincare and you have stubborn pigmentation that needs the laser, like the far left is a Forever Young BBL. broadband light, which is basically the modern version of IPL. And that is used to address brown and red in the skin. This patient has beautiful skin, just had a little bit of pigment on the cheeks that you can see. So that is after one treatment. The patient to the right was treated by our esthetician, Rebecca, and I believe she had 2 treatments, and obviously you can see she has redness, rosacea. So that BBL laser is addressing brown and red in the skin. So we can treat both. Something else that we can do in addition to the skincare is a chemical peel. And chemical peels, they get a bad rep. Nobody wants to be walking around with peeling skin, but peels have really come a long way from the Samantha Sex and the City days. But just some little points of what a chemical peel can do, because it's really a chemical exfoliation of the skin. Sometimes I dislike the word peel being used, but it exfoliates dead skin cells, promotes skin cell turnover. It improves the skin tone, the appearance of aging and acne. Safe for all skin types. We do have a chemical peel that can be used for any skin type here at LUX. 3 to 5 days of minimal downtime, and then best when purchased in a package. Peels are really something that even if you don't do a package of 6, you would still want to do 2-3 peels. This way you're addressing that dead skin that's on the top layer, and then you're getting a little bit deeper with that second and third peel.
We had a question, and I think that it had to do with the lasers, because it came through right as your transition. And it was, how many treatments does the laser take?
That all depends on the patient and what we're addressing. Typically, it's never a one and done with a laser. You're going to need multiple treatments. You know, we use safe settings, and we're all very trained, but you don't want to just go after the pigment and, you know, create more of a problem for the skin. But you know, our pigment is different colors. So if you look at your skin and you have spots on the skin, some are dark, some are light. The darker ones have been sitting there for a while. They're ready to go. So it will be an easier fix for the laser. The lighter ones, they need a little bit more manipulation. So it can take a few treatments, and especially with rosacea and redness, that definitely is a series of treatments.
Thank you. And then they also wanted to know, when is the peak of the peeling?
That can vary. I've had patients that will peel within 24 hours. I've had patients that it takes a few days for that peeling to begin. It all really depends on the patient's skin metabolism. Typically, and when I say typically, 9 out of 10 patients are going to begin peeling in 1 to 2 days of having the peel. And you will not peel all over. Usually you'll have some areas that have heavier peeling or heavier flaking. Some areas may not peel at all. Peeling is truly just a symptom of it. It's not the goal, but it's different for everyone's skin metabolism, when they'll peel and how long they'll peel for. So at LUX, we launched 3 chemicals, and they are all amazing, and they all can treat something different. The first description, the Restore and Relux, this is a peel that was, it's really unique. So if someone comes in and they have redness, they have reactive skin, they would have never done a chemical peel in the past, and they're, you know, scared to even hear the word peel, I've really tried to get them to understand that Restore and Relux is a peel that is an anti-inflammatory peel. So it is designed to calm redness. It can treat post-inflammatory pigmentation. It can treat rosacea and just sensitivity in the skin. Most patients do not really peel with this. Most patients will have 1 to 2 days of flaking. So it's just a mild exfoliation of the skin, but because of the acids that are used, they're designed to calm the skin and treat redness in the skin. The Restore and Reglow is a wonderful peel, so very similar to our glow pads. It's like the weekly glow pad on steroids. And this is designed for just a good exfoliation, more so for texture, but we do call it Reglow because when you're removing that dead skin on the surface, it is going to brighten the skin, and so you will have that healthy glow afterwards. And all of these peels too can be customized, so we can add in retinoic acid, we can add in more hydroquinone, we can make them stronger, but the base of them alone are wonderful. The final peel is the Restore and Rebright. And so with this peel, it is safe for all skin tones. And it is a 1-month kit of skincare that comes along with it. So you come into office, you have the chemical peel in office, and then you are sent home with 30 days of skincare. And in this skincare is a compound. And so in addition to that peeling that you'll get from the office treatment, it is slowly pulling out that stubborn pigmentation. So for kind of the best way to look at it is to mirror it with the NuDerm. It's the peel version of the NuDerm kit. And you usually will have heavy peeling with this, almost every patient does, but it is pretty quick. Within about 3-4 days, that peeling is done, and then you'll just have flaking for kind of on and off throughout that month. But after that peeling, that flaking is minor. It's nothing that you would have to, hide out in your home. You can go about your day to day. You'll just have that cell turnover and that flaking skin coming off. And so I have some pictures, and these visuals are wonderful. So you can see the first picture to the left, pre-procedure. So this is coming in for the day of the peel. The second picture is 1 month after 2 peels. And then 5 months later, she came back in, and you can see the result is just amazing, the amount of pigmentation that it cleared from the skin. The picture to the right is after 1 peel, and this was, it cut off, but this was about 3 weeks after, she was finished with the Renew and Rebright peel.
They wanted to know more about if these peels were customizable.
They are. So I was saying we can add in retinoic acid and strengthen the amount of exfoliation in the peel. We can also add in hydroquinone, so you can get added brightening to the peel. So each peel can be customized, and the Renew and Relux can also be used after a dermaplane. So that's a wonderful thing to do, to remove the dead skin and the vellus hair through a dermaplane, and then layer it with the Renew and Relux peel.
Great, thank you.
You're welcome. And just some more photos. Just wanted to show, all different skin colors. And so this first picture on the left was 3 weeks after she had finished the kit of skincare. And so you can see she has melasma on her skin where it looks like a mask of pigment. And so that treated for 1 peel very, very nicely. And the gentleman on the right was, I want to say, again, 3 weeks post his peel. And, even with the darker skin tone, that is sun damage that's happened over the years from sun exposure. So a very nice, even result for every patient. So a lot of information. Where do you start? You can schedule a virtual consult right now, and we have providers that are available for a virtual consult. If you wanted to speak with me, you can do that as well virtually right now before we open back up. And then you can shop our online store, and there is a description for each product on the online store. And then after today, if you use the coupon THANK-YOU10, you will get 10% off of your purchase.
Yeah, and I just sent you in the chat the links, because obviously you can't click on this screen on the links. But if you can't use those links and you want to find where the consult sign up is or where the online store is, you can just go to our website, which is luxhhi.com. We're going to hang out for a few more minutes. I'm going to do one more quick poll. It's basically just asking you if you'd like to be contacted for a virtual consultation. And we're also here to continue to answer any more questions. We're getting several answers so far. A couple people would like to be contacted, so that's great. We will, the Zoom doesn't give us your information until after we close it out, so it may take a few hours before you hear back from us, but we'll get your name and email address and reach out to you for a consultation. Somebody wants to ask, what are the best types of treatments for rosacea?
For treatments or products?
She said treatment.
Treatments. Laser BBL is the gold standard for rosacea treatment, and so that would be something you would come in and have a consult. If you have vascular lesions, you may need a 1064 laser, which vascular lesions being facial veins on the skin. But BBL can address overall redness and rosacea in the skin very nicely. And then we also have that Lumen peel, the anti-inflammatory peel. I've had several patients do both, and we kind of maintenance with the Lumen peel after they've done a series of the BBL laser. And so it's good to switch it up and do a little bit of both for the skin.
And then she did answer and she said actually both. So can you address the skincare products too?
Sure. So I was talking earlier about how when the skin is dry and dehydrated, it will not function properly. It's just like the body in that sense. And using products that restore the hydration and control the barrier of the skin are ideal. So the Lumen HA serum, which is the hyaluronic acid serum, is wonderful. It also has B3 in it, which is an anti-inflammatory. The Lumen B3 moisturizer is great. And then the daily brightening pads with the azelaic and mandelic acid are wonderful as well. And so just kind of you still are going to need exfoliation in the skin when you have rosacea. You still want to get the skin to have a workout. You just have to do it with the right type of acids. Salicylic is also a good acid for rosacea because it is a derivative of aspirin. So it calms redness in the skin. And so we have a daily clarifying pad if I have a rosacea patient that is still breaking out or has added oil in the skin. That's a wonderful option for them. And I'm trying to think of, and then the sensitive peel pads. So using those once a week, or it's like an at-home peel for the skin. And that is also the azelaic acid, which is the antimicrobial, anti-inflammatory acid, and then the mandelic acid.
Very good. Well, again, if you have any questions, you can we welcome them here. Like Susan said, we are also welcoming the virtual consult. As everything that she went over, we have options for you to take care of your skin and your issues at home, and we have them in the office. So right now we're here for you, whichever way you decide. And that's all we have for today. They said, thank you, Susan. You were wonderful and very informative. That's nice.
Well, thank you everyone for attending and for bearing with me almost losing it in the beginning.
You did great. All right. Well, everybody have a great rest of your day, and we look forward to seeing you in the office soon.
Bye. Thank you, everyone.
Bye-bye.